One. And welcome, everyone. Welcome to the Pursuit Podcast. We are making Orlando a better place. My name is Dr. Ron Miller of Pursuit Physical Therapy, and my colleague, Dr. Trey Martin, is also joining us today. Welcome, Trey. Good morning. We have a special guest today. I've been wanting to have her on the podcast for probably like a year or two now.
I know.
I think she's doing some awesome work. Dr. Linda Matteoli. Welcome. Thank you for joining us, and thank you for taking time out of your day to join us and help answer some questions and stuff. So Linda actually has her DO in MS and was graduated from the Lake Erie College of Osteopathic Medicine. I actually have some friends who are from Erie, and they say it's and it's irresistible.
Yeah.
Not with an I, but and she continued her medical training as a family medicine residency at Eastern Virginia Medical School, where she served as chief resident. She's board certified in family medicine and holds a master's degree in nutrition from Simon's College in Boston. Additionally, she has her undergrad degree in food and science and human nutrition at the University of Florida. We can't seem to get away from UF.
I know.
The University of Florida is everywhere, whether it's patients or people trying to apply for jobs, anything. So, Dr. Matteoli began her training at the Institute of Functional Medicine, which teaches healthcare professionals to get to the root cause of many lifestyle-driven diseases to a patient-centered systems biologically approach. She has also completed a applying functional medicine and clinical practice course, which also is some advanced training in functional medicine. So thank you again for joining us. We have a lot to cover, so I kind of want to start off and get started. Today we're actually talking about thyroid dysfunction. It's really interesting because two things. There's so much garbage on the internet for anyone watching this. It's really essential to kind of check your references and see where you're getting the information from.
Yeah.
And there's so much garbage, whether it's Google Doctor or just someone searching online, that it's really essential to get your information from a trusted, proven source. So that's why we wanted to have you on here today, so you can kind of give everyone who's watching this or some of our followers, some, evidence-based, some real legit information about thyroid problems, autoimmune diseases, and stuff like that. And then two, really highlight the importance of functional medicine. I think it's going to be the future of medicine.
I agree.
It's super exciting. I've almost taken a lot of principles from that and applied it to our clinical practice of solving the root cause of someone's pain. And we need to kind of promote functional medicine out there. So let's get started. So let's go over, what are some examples of thyroid diseases, disorders, dysfunctions that you see, that people are coming to you for? What are some examples? Autoimmune or just hypo or hyper?
Yeah. So great question. When I think of the thyroid, so just to kind of orient everybody a little bit. So the thyroid is that butterfly shaped gland just in the front of your neck. And it secretes T4, the thyroid hormone, that is responsible for a variety of things in the body, including body temperature regulation, metabolism, memory. It has a lot of impact on like brain health and mood and things like that. Also greatly is associated with fertility. So
I did not know that. No way.
Yeah.
That's
So you want to like optimize thyroid health for fertility reasons and things like that. So it impacts every part of the body. So if you don't have enough thyroid hormone, somebody can present as, they can be constipated, they can have dry, brittle hair. Sometimes they have hair loss in the outer thirds of their eyebrow. Their face can look a bit more puffy. In the later stages of not having enough thyroid hormone, they can even just get puffier elsewhere in the body, especially in the front of the shins and things like that. And they just feel very tired, and they can't tolerate cold very well. So the person that's like, it's 90 degrees outside and they have a sweater on. Symptoms of hyperthyroid, you're starting to think of.
Yeah, it's interesting because we're only in physical therapy, Trey and I, but for everyone watching this, in medicine, you always have a past medical history sheet that you always fill out.
Right.
And us being in orthopedics, we don't treat the thyroid as much. We kind of recognize red flags and have to refer out. But so many people, and Trey would probably second this, is that so many people check the thyroid box for having a thyroid problem. And
Yeah.
it's like we see it's more common than most people think. So it's
Yeah.
very interesting to hear this. But yeah, sorry for interrupting. Go ahead.
Yeah, absolutely. And then, so signs of hyperthyroidism, so an overactive thyroid, think of the opposite of hypo. So weight loss despite adequate or much more caloric intake than you would need for your body, diarrhea, anxiety, trembling, palpitations, and hair loss is another big one. So those are kind of like the hypo symptoms and the hyper symptoms. And what I'm seeing so much is, so when I think of the thyroid, as we were kind of discussing right before the podcast, is I think of it as like the canary in the coal mine. So unless there is a tumor or there's something that is wrong with the thyroid itself, most of the time a thyroid, either hypo or hyper functioning, is indicative that there's something else occurring. And one of the things that I really encourage my patients to do is to think of every symptom in their body as communication. So instead of feeling like, okay, I have constipation, I have dry, brittle hair, I'm tired, I have poor memory, I'm searching for this diagnosis. I want to be almost hypothyroid, so I know what it is that's occurring, and then there's like a clear path. So the whole point of functional medicine is to kind of get curious about it. Like, what is causing? What is my thyroid trying to tell me? Like, if my thyroid is all of a sudden starting to hypo function, like, what does that mean, and where do we need to kind of look further into that?
Yeah. Now, is hypo and hyperthyroidism the same as Graves' disease and Hashimoto's?
Yeah,
Or is it just that's the diagnosis given for hypo versus hyper? And
yeah,
then, because if someone just does a Google search for like Graves' disease or Hashimoto's, it comes up as an autoimmune disease. Now, is most thyroid dysfunction autoimmune disease? Can someone just have a hypothyroid problem but not be an autoimmune problem? Is there a
yeah.
difference between those?
Yeah, so that's a great question. So you have, so I think in terms of like flow, right? So you have thyroid disorders, then it branches off into hypo and hyper. And then if we go down the hypo track, Hashimoto's thyroiditis is a cause of hypothyroidism, but also is malnutrition, iodine deficiency, also is adrenal dysfunction. Um, so there's different subsets. In the United States, Hashimoto's is the most common cause of hypothyroidism.
Okay.
So here in westernized world, like that's most frequently what we'll see. And then if we go down that other side, you have hyperthyroidism. Graves is a cause of hyper, but as is if you had a toxic nodule that was secreting thyroid hormone, if you had a pituitary issue. So there's and even if you have too much iodine, actually that can cause like a hyperthyroid state. So but again, in the United States, the most common cause of hyperthyroidism is going to be Graves, because we don't typically have issues of not having enough iodine. There could be issues with the pituitary that need to be evaluated and ruled out. But those are going to be the autoimmune. So Hashimoto's and Graves are the autoimmune diseases for both hypo and hyperthyroidism, and those are going to be the most common causes here in the United States.
Very good. Perfect. So as you kind of referenced in like Western medicine, the US, how does standard healthcare or standard practice treat thyroid problems, whether it's hypo or hyper? What are,
Yeah.
from your experience and what other patients have probably told you, what does standard healthcare treat it as, or what's an example of how they treat it?
Yeah. So for hypothyroidism, they'll typically do additional testing. So a lot of times, so let me kind of review like what like kind of like the lab work a little bit to kind of orient people. So your the pituitary, which is a gland in the brain, secretes thyroid stimulating hormone and tells your
Oh, we're going to
thyroid.
go over the mechanism. I remember this
Right?
from med
And
school. It's like one increases and inhibits the other one, but then it
it's like a
inversely
feedback loop.
yeah, okay.
Oh, you should see me
Okay.
with patients. I have like a laminated picture and I
Yeah,
draw all over it because you have to understand, right?
yeah,
Like you have to kind of
yeah.
know. So the pituitary gland, which is a gland in your brain, secretes thyroid stimulating hormone, which is T4, tells your thyroid make T4. T4 is then converted into T3 in the periphery, and T3 is actually the active hormone. So T3 is the one that there's receptors on the cells, and that's going to have your body give you energy, body temperature regulate, all the things that we've kind of talked about. The cell then signals up to the pituitary gland, and if the cell is not receiving enough thyroid hormone, it tells the pituitary, hey, I need more thyroid hormone, at which time the pituitary gland then secretes more TSH. So a lot of times, especially for women, if they're going through like routine screening, if they're complaining of fatigue or if they're complaining of just difficulty with weight loss and things like that, the physician might add in TSH, which is thyroid stimulating hormone, as part of their panel.
Hmm.
And so if the TSH is high, that indicates that the cells are telling the pituitary, hey, I need more thyroid, I need more thyroid. So actually a high TSH is sign of a hypo functioning thyroid gland. So in a conventional world, if they do the TSH and say the TSH is like 6 or above, if it's high, then they might expand that panel and check T4, and then if that T4 is low, which means that the thyroid isn't producing the T4, then they'll give Synthroid. So Synthroid is the brand name for levothyroxine. I shouldn't say brand names, but so it's levothyroxine's generic
Yeah.
name. Most people know Synthroid though. And that is just T4. So they give the patient T4, which is an oral medication. And then the body is responsible for converting that T4 into T3. And that's kind of the workup. They may or may not check for antibodies. So in order to diagnose like a Hashimoto's perspective, they'll check TPO and antithyroglobulin antibodies. If those are positive, then it's more of an autoimmune picture. They might do an ultrasound to make sure that there's no nodules, especially if on physical exam the thyroid feels enlarged. But that's kind of the treatment would be, to give the thyroid hormone and then monitor every 4 to 6 weeks until it's in optimum levels.
But based on the mechanism and the work that they do, that patient's going to be on some sort of medication forever then.
Yeah.
Yes.
Yeah. It's not typical that the patient can come off of it.
Okay.
Normally when you start a thyroid medication, it's a lifelong medication. Yeah.
Okay. So I heard this, I think you even said this example to me. So you have a thyroid problem and you're going to be given this med that's going to, work out that kind of mechanism to even out the thyroid problem, but you have to take that medicine for the rest of your life. So where functional medicine comes in,
Mm-hmm.
and the most important thing is solving the root cause of why you have that
Correct.
thyroid dysfunction. So an example of what you sent or even mentioned to me once when I was talking to you was, say you have a plant that the leaves are turning brown a little bit, or you could see that this plant is kind of sick or dying.
Yeah.
And there's something wrong with the plant. You can't just take some green paint and paint the leaves green and make it look like a nice plant again that is fully functioning, alive and thriving, because there's something that's causing that plant to get sick, whether it's in the soil, or whether it's not getting water, or whether it's not getting nutrients, that's causing that plant to die. But you can't just paint the leaves green and say, look, my plant's all nice and neat. So as we go into this, because a lot of patients are probably asking this, is, one of the fundamental principles I love about functional medicine is solving the root cause of why you have your symptoms.
Right.
And that a lot of these diagnoses are just a diagnosis of symptoms. And the importance is solving the root cause. So briefly,
Yeah.
not going into huge depth, because a lot of people don't know what functional medicine is yet. Can you
Okay.
briefly
Yeah.
give them an example of what is functional medicine
Yeah.
and what do you treat as practicing functional medicine?
Okay. So what functional medicine is, as you introduce, is root cause resolution. So if somebody comes in and their TSH is elevated, I'm thinking, why? Why is this occurring for this patient? Yes, there's definitely times where somebody comes in and there's acute issues, like if their TSH is 100 and all these things, like they're going to need medication to stabilize.
Mhm.
So that's the primary difference. Is like we need conventional medicine for acute issues, for stabilization, for surgeries, all of these things. But for chronic lifestyle driven diseases, there's multiple different factors as to why thyroids don't function. And when I break it down, I think of nutrition, adrenal or stress, as well as autoimmunity. Those are kind of the three boxes that I start thinking of. And somebody can have multiple issues within each of those three boxes. But I'm trying to figure out, from taking an expansive history and lifestyle analysis of this human being, what where are the imbalances? Because you don't end up with a condition like heart disease or diabetes or thyroid disease just because there's one issue. And we're trained, I think, to think that there's just one reason why I'm feeling the way I'm feeling. It must be my thyroid. It must be my iron. It must be whatever it is that the stories that we kind of tell ourselves. But what in functional medicine, what we're trying to educate people on is that there's the sum of all parts make up the reason. So we do a deep dive into all of these different pieces of somebody's life and identify imbalances, whether it's gut health, whether it's toxins in their environment, whether it's stress management, sleep quality, all of these things. And we identify where those imbalances are and seek to restore balance in the body. I mean, if you look at the word disease, it's dis-ease, right? So we're trying to restore ease into the body. And I think the most powerful thing to me, the main difference is in medicine, I'm taught, okay, diagnose hypothyroidism and then move upstream. So then I know, so once I have this diagnosis, I know exactly what medication to start. I know what dose to start. I know how to monitor it. I know all the things. Functional medicine had me think the opposite direction. So two people can have the exact same disease, but what's driving the disease can be completely different in two
Yes.
different people. And that's where functional medicine, I think, shines, is because two people can have a TSH of 20, but one person could have severe Hashimoto's caused by significant gut dysfunction. This other person could have this elevated TSH because their iodine is low and their adrenals are shot. So you need to kind of, and honestly, that takes time. So that's why a lot of functional practices are cash-based, because it takes an hour to 90 minutes intake to just kind of figure out what this, where this person came from, the environment this human being has been in, and just kind of unravel all those little pieces.
I think you said it really good right there, so people can understand that.
Yeah.
You can have 10 people diagnosed with the same thyroid problem, but
Right.
they have different underlying root causes. For
Yeah.
like Trey and I, we see 10 different cases of low back pain, and there are 10 different causes of it. Some people may have a herniated disc. Some people may have a SI joint problem. Some people may have, it could be like a hip flexor problem causing it. So not like the public wants to have that diagnosis because that's been ingrained in us. And then once they have that, they just kind of go for the standard care option of it. But a lot of times that doesn't work. And
Right.
then what do you do after that doesn't work? Then you have to almost kind of look at other options. So the important thing that she said there was, for everyone listening, is that you can have one person with, two people with the same diagnosis but have underlying different root causes. And to get the outcome that you want, you have to solve that root cause. I'm sorry, Trey, you were about to say something on that?
Yeah, can you touch on gut dysfunction a little bit? I know gut health is a major trending 2020 topic, so just curious, just a quick overview. I know that could get pretty downstream, but just kind of what you're seeing with that.
Yeah. So I feel like when it comes to the gut is an absolute cornerstone to any disease process. So if I'm trying to build a house of health, there's certain cornerstones, foundational pieces that we need in line, and the gut health is one of them. One of the main things that is so significant for gut as it relates to the thyroid is that because autoimmunity is one of the most primary drivers of hypo and hyperthyroidism, a lot of autoimmune conditions orient because of gut dysfunction. And the reason being, kind of to your point, is that the gut is basically our barrier to the outside world, right? So it goes from it's tube from our mouth to our anus. And that's how our body gets information from the environment, right? From everything we eat, from what we swallow, from what we're breathing in, and all of these things. It goes through our GI tract. That's giving our cells and our immune system and our GI tract information. So if we are living, as many of us are in this westernized world, if we're living in chronic stress, so we have a high amounts of cortisol kind of pouring through our body, we're eating high inflammatory foods, processed foods, unclean water that's not filtered, that's all information that's kind of coming into our gut. What happens over time is that those gut cells, they become inflamed and they actually start to kind of like separate a little bit. That's called gut permeability. And when those gut cells separate a little bit, like if you imagine the gut as like this pipe and the webbing around it is your bloodstream. So if you have food going through that pipe and now the cells and the inner lining of that pipe is now brittle, toxins and highly processed food and all of these things that we're consuming is now going through those cells and now going into that bloodstream, and our immune system is in our bloodstream. Now we have our immune system thinking that it's like under attack because all of a sudden we have all this pouring in. The barrier is no longer intact. That affects inflammation. That affects brain health because there's a big gut-brain connection. That affects autoimmunity. So if I have somebody coming in and they have anxiety, they have insomnia, they have constipation, they have bloating, and we have thyroid antibodies, I'm all in on the gut. Mm-hmm. And to kind of take it a step back a little bit, for the gut, I'm thinking of, is there an issue with, is there an overgrowth of bacteria? Is there an overgrowth of yeast? Is there food causing inflammation? Stress is causing inflammation. So again, you keep going back. So it's like, okay, we have a gut dysfunction. Now, what are the things that cause the gut dysfunction? It's like these main primary things. So we do a workup to address that. But then of course there's a giant lifestyle piece, because we can do the biggest gut workup in the world and we can do the best protocol that ever was. But if that person is still eating inflammatory foods every 3 to 4 hours, their inflammation at the gut level will never calm down long enough to heal, because it takes about 8 to 9 hours for inflammation to calm down after a high inflammatory meal. Wow. And so, do you know what I mean? So that's there was actually a study on it. There was a graph. And so you look at, like, I always think of little kids, right? So you give them a breakfast, and they might be wired all morning. Their inflammation hasn't calmed down by lunch, and then they get another hit. Like they get the cookies and they get the chips and they get the whatever. And then it takes like 8 to 9 hours for that to really calm down. So that's why in functional medicine, we really start with the nutrition and the lifestyle, because that's continuous information that you're feeding the body. Like if there's one thing from a functional medicine perspective to remember, is that everything that comes at you, the environment that you put yourself in, the little choices that you make throughout the day, that's information that you're giving your body. Symptoms that you're experiencing is feedback from your body to yourself. How does your body feel about this environment that you put yourself in?
It's wild too, because you can really feel it. I don't think many people think about food in that much detail, but I noticed like last week, and I had a few poorer meals, and immediately you feel a little bit more inflamed, a little bit more upset in your stomach. You feel lethargic. And to me, I asked my girlfriend after the weekend, I was like, how do people live like this all year? This is like one weekend for us, but kind of to your point, it's interesting just how quickly you can see how food can affect both your mood, your mental clarity on things, emotional levels, stomach, all that stuff. So pretty interesting. But thanks for diving in that for all of us.
Yeah, absolutely.
Do you feel a lot of people who have thyroid dysfunction have a gut health problem? Like say if like 20 people came in with a thyroid problem, what percentage of them do you feel has a gut health problem?
Oh, I think that the vast majority, the gut is a factor
Yeah.
in
And
it.
they don't even know it. They don't even know it.
Yeah.
Yeah.
Yeah. I mean, I think of like when it comes to hypothyroidism, I think of nutrition. I think that the adrenal glands, which is your main stress response gland, right? So nutrition, gut, and then the stress. But even from a nutrition perspective, like if somebody's super low, so there's certain minerals that you need for the thyroid to work. Zinc, selenium, and iodine are probably like the main big ones, along with B vitamins and things like that. If I'm doing a nutrition panel on somebody and all those minerals are low, my question is it poor intake or poor absorption? And if they're like, I'm eating like a super plant-based whole food organic diet, then I'm like, you're not absorbing. So it goes back to gut. So everything kind of like goes back to it. Even if there's an autoimmune issues for somebody like that, typically orients in the gut. So it really is a cornerstone because that's where you're absorbing all the cofactors, like the vitamins and minerals that our body just needs to do basic cellular processes.
Yeah.
And
So
yeah, go
that
ahead.
was another good point there, because just because you eat something doesn't mean you absorb it. So she
Right.
said there was two things with, gut health. Is it a new nutrition problem, like you're not consuming it, or are you not absorbing it? And
Right.
I got blood work done last year, and I eat probably steak, eggs, spinach. I eat fairly healthy, and I was low in vitamin B12. I was like,
Mm,
how the hell am I low in vitamin B12 when I eat eggs almost every other day? I eat steak. I have spinach. I mean, even eating a multivitamin also, it's like, how am I low in vitamin B12? Obviously, it's not a consumption problem. I'm consuming a lot of vitamin B12. But
right.
for some reason along my track, I'm not absorbing it. And
Right.
that's even me eating healthy, eating a piece of kale, eating multivitamins, eating a probiotic. So it's not just people who aren't living a healthy lifestyle. Even some people who do live a healthy lifestyle, you have to solve the mechanism of, you could think you're healthy, but you could be nutrient deficient in that one. I think you said zinc, selenium, and some of the B
Zinc.
vitamins that
Yeah.
may help. So even a healthy person could have a thyroid problem. You may be lacking some of those nutrients that your thyroid needs to be essential and function properly and stuff like that. So yeah,
Right. And I think that it's like one thing that I really work hard with my patients in understanding is that I think that we've come to a mindset of like a static mindset where they like, this is the diet. This is the diet for me. This is what's going to be healthy for me. This is the exercise for me. And then they go all in on this for a significant period of time. And I encourage my patients every 90 days, like check in. So people be like, this diet worked for me so well a year ago. I'm doubling down, even though I'm continuously feeling worse. I read somewhere that this is the diet for hypothyroidism. And I think that it really does a disservice to us because we're not tuning into our own symptoms and what's going on, and things typically need to shift, and it's okay to shift. It doesn't mean that something's wrong, but like every 90 days there might need to be a change in our diet, our lifestyle, our eating habits, everything. Yeah.
now do many patients come to you with the diagnosis of Hashimoto's or Graves' disease, or is it something they come to you with a complaint of a list of symptoms and you
Yeah.
just so happen to find that it was a thyroid problem, or is it both?
Yeah, good question. It's frequently both. I think a lot of patients come to me because they're kind of they they felt bad. They got diagnosed with hypo or hyperthyroidism. They're undergoing treatment, and they may have felt better for a few months, and then they've been told, okay, well now your thyroid levels are optimal, but then the patient just still doesn't feel good.
Yeah.
And so then they come to me to kind of do a bit of that back work. So I think of myself as kind of the detective or the investigator, kind of like behind the scenes, and I don't take the place of their endocrinologist or their PCP or anything like that. I'm kind of working behind the scenes on all of that. But I do my first appointment is called the foundational assessment, and it's where we I get a bunch of blood work done before they even walk in the door. So I do a full thyroid panel. I'm checking the TSH, I'm checking the T4, the T3, as well as the thyroid antibodies. And I'm looking at zinc levels, iron levels, a lot of vitamin and mineral levels that can impact that. So at that first appointment, I might diagnose them with overt Graves or Hashimoto's, which I have, or I just might say, you have some antibodies, but your thyroid is just suboptimal. Like the levels aren't like, we have the lab ranges, which are developed by a bell curve essentially. And then we have like the functional optimal ranges. And so, so we kind of we're looking at all the gray areas, like where, and so that's more frequently, to answer your question, that's more of the discussion. Like you're not converting that well to from T4 to T3. Why is that? Let's discuss what could be occurring here. What is it about your history and your life that could be contributing to this? And it's more of that discussion.
Yeah. Let's start talking about treatment too, because I remember my wife Haley has seen you, and she's been public about her stuff anyway. But it was really interesting when we first started. We were worried about her thyroid also, about does she have some sort of thyroid problem, and you were able to solve that root cause with her without taking medications and kind of balance it out and almost prevent that from happening, where her thyroid is functioning good now without having to take medicine. So some examples, like if someone Googles functional medicine, a lot of times, or watching YouTube videos or TED Talks on functional medicine, I think they always see things like, solving the root cause, looking at like blood work, looking at toxicity levels, food allergies, that epigenetic stuff. What environmental factors were they exposed to that could have been activating turning the genes on that causes the autoimmune problems? Am I missing anything with that? You said, and like nutrition.
Correct. Yeah, those are the main ones. Stress is a big one.
That's another one,
stress. Not enough calories can be a big one, or not absorbing your nutrients, toxins, including like mold exposure, heavy metals. And it can feel very overwhelming. And typically what I do is the timeline. What we're taught in functional medicine is to do a very detailed timeline of a patient. And that gives me so much information. I mean, I spend sometimes up to an hour just going through somebody's history, because if I have a patient come in and the first thing I ask was, when was the last time you felt well? And they're like, oh, it was 10 years ago. I'm like, okay, tell me about that. And then they say, I was living in a dorm room and I was in college, and all of a sudden I just started feeling like I had a lot of brain fog. I was having all these issues. And then I was diagnosed with Hashimoto's, and I just haven't been able to come up for air since. So then I start thinking, like, what was it about that environment that pushed this person over the edge? Because a lot of us, you know what I mean? Like, we live with a bunch of imbalances all the time. Like, we're not perfect human beings, and our bodies are meant to deal with a lot. So there's some things that occur for somebody where they're just off balance, but then there's always some sort of event that pushes them over. And so my job is to figure out what is that triggering event. And for some people, it can be like just their living environment. They were living in a moldy home. So now I'm kind of going down that path. So I'm trying to figure out what was occurring for that person when they last felt well. And then in order to solve the patient's case and to rebalance them, that needs to be solved, along with like all of the other things like the nutrition and the sleep and the stress and all the things. But it's typically that one piece that makes a big difference.
Yeah. You are kind of like a investigator going back and solving the case and going
great.
back deep and trying to solve that problem.
Yeah, it's fun because I think the way medicine is now, and it's through no fault of the doctors or the patients, it's just the environment in which they are with insurance-based medicine. It's like they have 10 minutes, 15 minutes, and you just can't, it's just not enough time. Yeah. Like patients just need time to unravel. We're complicated. And I think
many times it's not just one thing. It
No.
could be a whole slew of things that are adding into why that patient has certain symptoms, and you just got to pick one thing, solve it, treat it, move on to the next thing. Keep focusing on what's best for that patient to make them better.
Correct. Yeah, it's like I think of it as almost like a ladder. It's like you take one step up and then the next, and then you're just kind of building. You're kind of just
Yeah.
building as you go. Yeah.
So it was interesting that you mentioned it because we have some patients that are dealing with this, and they had a really good question. Have you found those with autoimmune thyroid problems having a dairy sensitivity? That was one
Oh,
of the
yeah, good
questions.
question. Yeah,
That's
good question.
one of the questions that someone asked.
Yeah, so what we know, so gluten and dairy are probably like the two big ones when it comes to thyroid. And the reason being is that gluten in particular is structured similarly to the thyroid gland. So if you have an overactive immune system, like we talked about because of the gut permeability, that barrier breaks down, there's something called molecular mimicry, where the immune system will attack the thyroid because it thinks it's gluten. To bring this to dairy is that gluten and dairy, there's a lot of cross reactivity there. So one of the first things we do when there's a thyroid issue is that we do an elimination of gluten, dairy, along with some other higher inflammatory foods. And the reason for that is we're just trying to calm down the immune system from a gut perspective, and that can typically relieve a lot of symptoms for patients right off the bat.
Nice. One of the other questions that we had, and then we'll start closing this up, because I didn't know thyroid dysfunction can influence fertility problems. That was new
Yeah.
that I learned today. But one of the questions was Hashimoto's and pregnancy. What is the best approach to treat this and still have the opportunity to have a healthy pregnancy? Do they have to solve the Hashimoto's first in order to have the fertility and the opportunity to get pregnant? How do you kind of go with that? And is it,
Yeah.
which I didn't know that it was even a problem, but obviously it is with
Right,
thyroid.
right. So with Hashimoto's and pregnancy, um, I do recommend if somebody has a history of autoimmunity or toxicities or severe gut issues, to take like 6 to 9 months to kind of calm down that inflammation before pregnancy, because pregnancy just stirs up a lot of different things for somebody. But it's you. There's plenty of people who have Hashimoto's that do get pregnant. It's more about having the strongest possible body during the pregnancy. So it's not like an absolute you can't get pregnant if you have this.
Yeah.
It's more about let's kind of calm down the body and restore balance, so you can have a healthy, happy, and feel vital during your pregnancy. This is a big piece of it.
Perfect. Good. And Trey, was there another question that you had about treatment? I believe you wanted to mention something.
I had a very specific question about pregnenolone. This is just kind of personal question, but my girlfriend had really high levels of pregnenolone on a blood panel. So I did my Dr. Google, obviously not my field, and all I could find was low. It mentioned when you're like 40 plus, levels drop down, and a lot of people were taking supplementary pregnenolone. Hers was like double the normal limits, sky high level. I think thyroid was trending down too, but she went to see a functional medicine doctor, I think in Winter Haven.
Okay.
You guys probably know each other in some pathway or another.
Yeah.
Maybe you actually, I'll have to ask, I'm not sure. But I was just curious if you'd ever seen cases of those levels being really high.
So for pregnenolone is kind of like your mother hormone, so to speak. Like it's responsible for estrogen, progesterone, testosterone, all of that production. So if somebody came to me, and you're right, higher levels of pregnenolone is not something that we frequently see. My approach would probably be to first repeat the lab and see if it's real or not. Because sometimes the thing to remember about hormones is that it's typically not like an absolute, like it's not like vitamin D deficiency where it's just low. The hormones work in such a symphony with each other. So if one's high, it's either because there's an issue with the gland itself that's hyperproducing it, or it's compensating for deficiency somewhere else. So I would probably repeat the test. That's probably step one. Like, is this a real value, or was it a lab error or whatever? And then number two, I would look at estrogen, testosterone, progesterone, DHEA, like that, the whole endocrine axis, to see if there's dysfunction elsewhere that's causing that pregnenolone to react that way. And then if all of that looks normal, but pregnenolone is just high, then I would probably want to look at some like imaging studies to see if there's something that's causing some secretion of that hormone.
And is that something that can be just high depending on what level of the menstrual cycle you're in? Do hormones fluctuate significantly enough lab value-wise depending on phases?
Yeah, so estrogen and progesterone definitely fluctuate greatly during the menstrual cycle. Pregnenolone, I don't think of as fluctuating quite as much, or testosterone doesn't fluctuate quite as much, but progesterone and estrogen, FSH, LA, all of those do. Pregnenolone, I don't think of it as that one, but I would have to kind of look into that a little bit deeper to see how much it would.
I have one last question. What's your stance on prolonged fasting? Do you think that has any utility for?
Ooh, that's a good one.
I guess
Yeah.
making your.
That is a hot topic right now,
Yeah.
Dr. Ray.
I used to dabble with it, and I had a few people tell me that it was okay for men, but awful for women because of the scarcity of food would make their hormonal systems go into whack. I didn't know one way or another, but I was just curious if that was an approach you've tried with anybody for
Yeah.
long-term.
So this kind of goes back into phases of treatment.
Mhm.
So initially, especially for women, if I initially have somebody come in, when I think of the hormones, I always have such long explanations, but I feel like it's important to understand why. But I always imagine like a pyramid, right? The bottom of the pyramid is insulin. The layer above that is cortisol. The layer above that is thyroid. The layer above that is all your sex hormones. Each layer of the pyramid responds to the layer below. So if somebody comes in and they're like, my thyroid is messed up or my sex hormones are messed up, I'm looking at the base of the pyramid. I'm looking at insulin. I'm looking at cortisol. When somebody does not eat regularly, like every 3 to 4 hours, it affects your insulin and it affects your cortisol, because one of the main jobs of cortisol is to tell the liver to put glucose into the bloodstream when the body doesn't have any glucose, right? Because you're fasting. So if somebody has a thyroid issue, and if one of the main reasons they have that thyroid issue is because of their poor stress response and their adrenal issues, that is somebody that I do not want fasting, because that's going to cause their cortisol to go sky high to try and get more glucose in the system, and it's going to make everything else more complicated. Mm-hmm. So my first step for most people is, for the first 90 days while we're trying to get into the gut and we're trying to get good lifestyle habits, is to have regular meal times. And that is just to send the body a signal of safety. We live in this world where we're just getting like bombarded with everything that causes so much anxiety and worry and all these things. So if I can create, from a food standpoint, to your point, a signal of safety throughout the day, that's number one. Once they're stabilized and things have calmed down, I do try and do some slowly restrict that time. If the patient feels tired, if they have increased anxiety, if they have increased like nervousness or jittery, then we kind of like expand out another hour, and then like that's kind of where they live. So there is it really is linked to the adrenal function. Now for men can kind of move through that time period a little bit more quicker. Like I think that men, they tend to do well on like a paleo-ish diet. They just do well on it. They do well with time restricted eating. They feel great. They have no issues sleeping.
Fasting, and I should be good.
Yeah, they just kind of feel really good. And so I guess my point is that if it, like, listen to the signals your body's telling you, mm-hmm. and if you feel good, you're sleeping good, your mood is stable, then your body's like, I like this, it's fine. But what I try to avoid is to pigeonhole patients and be like, time restricted eating is good. I read it all over the place. And then they kind of force themselves and they feel awful. And then they feel like their body isn't working for them, or there's something wrong with them. And that's something that I just really try to work through with patients, because I think that that's so detrimental.
I'm curious, you talked about kind of intermittent fasting. What about like a prolonged fast? The way I understand it is your cortisol spikes and your metabolism spikes the first day, And then after 2, 3, 4 days, around that 72-hour mark is normally the magic window.
Yeah.
All of those things start to kind of go back down. Is that something that you find as being, a lot of people when I talk about fasting, they think I'm crazy because I've done up to a 3-day fast and I'm still here, but is that something you see utility with to repair the gut health and stuff like that? Does that give you a time to regain that permeability layer and give some correction to the stomach lining?
Yeah. So prolonged fasting, like 72 hours, there is benefit from like an anti-aging apoptosis, which is like cell death. Like the cells just kind of clean out all the muck. If somebody has strong adrenals, strong thyroid function, then I think that there's, it's okay to do. I will frequently recommend for patients to do like a 24-hour water fast, like once a month or twice a month. Sometimes, yeah, as we get further on in treatment with patients, there's a lot of discussion about like, how do I sustain this over the long term and still have like a life?
Okay.
And we'll discuss like, you're going to have holiday dinners, you're going to have birthday dinners, but you have to know how to reset yourself. And for some people, that's a 24-hour water fast on Monday.
Mm-hmm.
And then they feel totally reset. For somebody who's just starting, and if they're pretty ill, I would not say like, okay, to start treatment, I need you to start with a 72-hour water fast. Like I probably wouldn't do something like that. It would just kind of depend on the individual. But I do think that fast is a really nice reset, especially if the person has just gone through a high inflammatory environment exposure, and they just need a nice little reset. But I wouldn't, more than 48, 72 hours, I would probably want to like have some sort of, I wouldn't recommend that to the general public.
Yeah.
Right. Okay. So it sounds like that's more I don't want to say advanced, but that's more of like you're pretty metabolically healthy, you're in a good spot, and you're trying, maybe to squeeze out an extra year or two of life. That kind of makes sense though, because I would imagine most people, if you're metabolically sick and you're feeling unwell, you put them on a 72-hour fast, they're probably never going to come see you again for one. It's not exactly a fun experience. And so, yeah.
No, and I don't want them passing out. Like,
Yeah.
I mean, I don't want I want to make sure their blood sugar is stable, that they can handle it. I mean,
It's very interesting. The concept of fasting is really interesting just because I don't do well on fasting, but I do great on a paleo diet. So I know that it's almost 10 o'clock, so we have to go. So we've gone over the different types of thyroid problems, hypo versus hyper, Hashimoto's versus Graves' disease. We've gone over some of the symptoms. Linda kind of went over some of the symptoms of what a lot of people are complaining about when they have a thyroid problem. We've gone over the difference between standard healthcare and a functional medicine treatment approach and how that differs. And Linda actually outlined some examples of cases of what she does with some of her patients that have a thyroid problem, whether they're even coming because of the thyroid diagnosis or whether they're coming because of some other symptoms. So if anyone does have questions for you or wants to find out more information about your practice, how can people get a hold of you?
So we have a website. It's originsfunctionalmedicine.com. We're on Facebook, we're on Instagram if they want to check us out there. And our office is in Longwood, and our phone number, I don't know if you want me to say my phone number if that's helpful.
Yeah, good.
But okay. 407-902-4912.
Perfect. I'm going to put links below here. Perfect. Of all your website, social media, and like stuff like that. So we're going to, if anyone has any comments or questions, you can put it in the comment box below. I'm not going to let you off that quick yet. You have to answer the Fab 5 questions. Are you ready? Okay.
Yes.
Okay.
What is this?
The first question is, what book are you reading right now?
Oh, I'm reading Untamed.
Oh, what's that one about?
I'm blanking on her name, but it's Untamed by.
What's it about?
It's about her. She's married to a World Cup female soccer star, and it's just all about her evolution as a woman.
Oh, cool.
Yeah. So it's really interesting. It's about kind of the stories you tell yourself and breaking down barriers and
nice.
letting go of your stuff. It's cool.
Number 2, what is your favorite restaurant in Orlando?
My favorite restaurant in Orlando, I do not go out a lot in Orlando.
Well, right now also, it can be Orlando and surrounding areas, but a lot of people haven't been going out. This is being shot in 2020, so we're in a COVID crisis.
Any sushi restaurant, to be honest, any
Ooh.
sushi restaurant. I'm a big giant sushi fan. So
we actually ask this question a lot to patients with the top 3 restaurants, and the top sushi ones are always Sushi Pop and Kabuki Sushi down here in more Orlando. So
I also like, just as an aside, there's a newer restaurant called Hungry Pants. Closer to downtown, and it's like a vegetarian vegan, so you may not like it, Ron, but
nice. Oh, it's all good.
But it's super cute. It's I really like Hungry Pants. I go there with my friend a lot. Yeah.
Okay, number 3. What is another up and coming small business? It could be a product, a service, a restaurant that is up and coming that many people may not know about in Orlando that you really like what they're doing. You may have already mentioned it, Hungry Pants.
Yeah, Hungry Pants. I do want to give a plug to one of my friends, Sarah Geha. She's Geha. You can find her online. She's opened up a business where she's a nutritionist, but she really looks at things from a toxic perspective. And I just think that she offers a wonderful service because this woman is so educated about toxicities in our environment and how it affects our hormone health and our gut health and everything. And she kind of goes into your house and she looks at your Wi-Fi, she looks at your water, she looks at like all of the things. I mean, any question that you might have, like what mattress should I get? What cleaning supplies should I get? Sarah Geha Wellness, she's probably like, I'm really like rooting for her. She's doing a great thing.
Nice. We'll have to tag her in a post below too. Number 4, what is something that you're doing right now to keep yourself healthy?
Oh my gosh. So there's a meditation device called Brain Tap, and it's braintap.com. And it does binaural beats. So it's like headphones and then there's lights. And I use it before I go to bed because it helps you get into like the delta wave. And I use it kind of first thing in the morning to kind of get my mind right for the day. But I have young kids at home, and so I'm kind of jumping between business owner, doctor, wife, mother, teacher, like
a lot of hats
all day long, as I know a lot of people are. And I really love the Brain Tap because it's like 15, 20 minutes, and I can just go take a minute, and it's a nice little reset. So that's probably my COVID. That's my COVID gold right now. That's how I'm lasting.
It is such a hard balance having all those different hats. So yeah, we'll have to look into that. That's something new.
Yeah, it's really cool. I love it.
Last question. What is one problem in healthcare that you want to see change? That's a big question.
What I would like to see changed is I would like doctors to have a bigger say in just how they run, how they operate. I would like insurance companies and the MBAs and the administrators and the big pharma, like I would like them to not be so involved in decision makings, and I would like healthcare to be more about doctor-patient personal relationships. And because at the end of the day, the healthcare system can't work without doctors and patients. So the more that we kind of bind together and create something that works from both parties, then I think everything will kind of calm down. I don't know how that would work, but that's the most frustrating thing to me.
Good.
Yeah.
So good. So that's Dr. Linda Matteoli. That's Origins Functional Medicine. And I think a lot of people are really going to enjoy this and like this. And thank you for taking time out of your day for making Orlando a better place.
Yeah, thanks for having me. Have a good day, guys.
Yeah, thanks for coming on, Linda.
Thank you. No problem.